All right, so let's talk about some of the illustrations in the Why Do I Hurt book. You use a rusty nail and an oncoming bus.
Yeah.
Give that story for us.
Yeah, so those are two different stories. So the first one is the rusted nail, right? So when patients come to us, so we always thought, what's a very benign thing to start a conversation? We said, if you step in a rusted nail, do you want to know about it? Well, I've never really experienced anybody say no. They say, well, yeah. And then the question sort of begs is like, why do you want to know it? Well, I can get an infection. Okay, cool. So how do you know there's a nail in your foot? Uh, and that brings us the conversation that we have a very sensitive alarm system in the nervous system, buzzing along, enjoying a beautiful Thursday morning, and you step in a nail, the alarm system ramps up in your foot, sets off the alarm, ding, 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 it fires to your leg fires into the back, fires to the brain going, and the brain produces pain to make you stop, pay attention, and then you deal with the nails, you get a tetanus shot, etc. So pain is produced by the brain to get your attention to deal with something. And theoretically, what happens if you pull the nail out, the alarm calms down and life goes on. But in 1 in 4 people, Jason, something trips the alarm, ding, 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 you hurt your back, you're in a car accident, you're under stress. We take care of the problem. We go see the doctor, the chiropractor, we get an x-ray, whatever, but the alarm system doesn't come all the way back down. So now I have an extra sensitive alarm system, which in fancy terms is speak for central sensitization, allodynia, hyperalgesia, fancy words that just says your nervous system is screaming at a high level. And that is an underlying mechanism of pain. So we've taken a complex idea, put it in a story, and a patient would literally sit there and go, oh, wow, no wonder I'm still feeling my leg. Yes, your alarm is going off. And then they ask you, how do I turn it down? And you go, yes. How do we turn it down? Well, we learn more about pain. We sleep a little bit more. We exercise more. We do graded exposure. So now we lay out a plan to calm the system down and not necessarily fix the joint or fix the muscle, which is healing over time anyway. The bus story is another one. We'll ask people if you sprained your ankle, would it hurt? And the answer is again, yes. We've not really had many people say no. Well, imagine you cross a busy street and that split second you roll your ankle, you see a speeding bus coming for you. Does your ankle hurt? And the answer is no. Well, why not? Well, the bus is coming. So our brain is this protect meter. It evaluates life. In this point, the ankle is actually not helpful, so it shuts the ankle down. We run across a busy street on a sprained ankle, and the bus speeds by. You don't even feel your ankle. And then as soon as the bus speeds by, you go, I can feel my ankle. So our brain makes decisions every day based on these threats that are around to turn on pain, yes or no. And by the way, threats can be from injuries, but they can also be from a very stressful time in your life, or I'm facing surgery. So these are just simple stories that resonate with people, that they can learn a little bit more about how pain works in the human body.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.